We're live. Dr. Furr, you may begin.
Good evening, everyone, and thank you for joining us for this virtual town hall on the post-fire air, water, and soil assessment plan. I want to start by thanking our local, state, and federal partners, along with academic and research institutions for their commitment to wildfire recovery. Addressing the environmental and health impacts of these fires requires coordination and expertise. And we're fortunate to have specialists in toxicology, air quality, and environmental science identifying hazards, informing mitigation strategies, and securing the information that's requested by you, our community residents. Tonight, we have several of these experts here with us, bringing a wealth of experience to this discussion and sharing critical information to help answer your questions. Our town hall will begin with brief remarks from our panelists, who will provide an overview of recent assessment efforts. After that, we'll spend the rest of our time answering your questions. As a reminder, you can send in your questions in the chat on YouTube, Facebook, or Twitter. We'll go to the first slide. Please note that we have live Spanish translation services during our event tonight. Para escuchar en español, por favor, llamas 1-800-805-1150. Before we move to opening remarks from the panelists, I want to be sure you all know how to connect to available resources. We'll take the next slide. To ensure that residents have easy access to critical information, Public Health created a dedicated post-fire air, soil, and water assessment plan webpage. And you can get to this webpage by going to our website, which is easy to find, publichealth.lacounty.gov, or you can scan the QR code that's on this screen. This webpage is a central hub where you're going to be able to find the latest assessment updates and results based on ongoing monitoring efforts. The page includes a search function, allowing you to look up specific data by location, contaminant, or agency conducting the testing. Whether you're looking for soil sampling results in your neighborhood, air quality findings, or water safety updates, this tool should help you quickly access the information that matters the most to you. And because wildfire recovery is an evolving process, the page is updated weekly as new information becomes available. We do strongly encourage all of you to check back frequently for the most up-to-date findings and public health guidance. If you have specific questions or concerns, there's also an email contact listed where you can reach out to Public Health and we'll respond to your email with the additional information you request. The next slide. In addition to the assessment plan, we have a wildfire safety and health information webpage, which provides comprehensive guidance on protecting your health and navigating the recovery process. You can get to this webpage by visiting publichealth.lacounty.gov. And this webpage is going to include health officer orders outlining public health requirements for fire debris removal and cleanup to ensure safety, recovery resources to help you, businesses, and schools manage rebuilding efforts, access financial assistance, and understand cleanup procedures. There's also fact sheets and guidance documents on key topics such as safe cleaning practices, air and water quality concerns, and workplace health and safety. Public health advisories are listed there as well, hoping that you'll be able to stay informed about evolving health risks in affected areas. There's also resident frequently asked questions. This is based on your real questions. You submit these via our website. We try to provide clear answers about returning home safely, understanding test results, and minimizing exposure to hazardous materials. And these also get updated regularly. Our resources are designed to support individuals, families, and businesses as you're all recovering from the fires. Slide 4. As a reminder, we still ask that you take precautions to reduce exposures to contaminants. This includes using N95 masks, gloves, and protective clothing if you're in areas with a lot of ash and debris. We remind everyone that you can also use HEPA air purifiers indoors and to keep your windows closed if the air quality is poor. Not handling fire debris or contaminated soil without proper protective gear remains important. And of course, stay updated on water safety recommendations, particularly if you've been in an area where the water's been turned off before you drink or use the tap water. This information is also updated and available on our website. With this in mind, I'm pleased to introduce our first speaker, Dr. Nicole Quick, who's the Chief Medical Advisor for the LA County Department of Public Health. Dr. Quick brings extensive experience in environmental health and emergency preparedness, and she'll provide an overview of the health advisory and the revised health officer order. She'll also discuss how contamination levels are being tracked over time. Welcome, Dr. Quick.
Good evening, everyone. First, I want to acknowledge the incredible loss that so many in our community have experienced as a result of the Palisades and Eaton fires. The destruction of homes, businesses, and infrastructure is devastating, and we know that the recovery process will be complex and ongoing. Our top priority is protecting public health as we move forward with cleanup and rebuilding efforts. All right, next slide, please. Given the scale of the destruction, it is critical that fire debris and ash are handled safely to prevent further harm to residents, workers, and the environment. Fire debris may contain asbestos, heavy metals, and other hazardous substances, which can pose serious health risks if inhaled or if they contaminate drinking water. Improper handling and disposal of debris can spread these hazardous materials, increasing exposure risk for the entire community. To help ensure a safe recovery, the county health officer has issued a revised health officer order providing clear guidance on the removal, transport, and disposal of fire-related disaster debris. This order aligns with the Phase 1 and Phase 2 debris removal process and applies specifically to the Palisades and Eaton burn areas. The order prohibits the removal and disposal of fire debris until Phase 1 hazardous waste removal is completed or deferred by the US EPA. Property owners who opt out of Phase 2 or do not qualify must obtain county approval before proceeding with fire debris removal. All debris removal must be conducted by appropriately licensed contractors and in compliance with Cal OSHA worker safety requirements. Public Health has the authority to conduct representative soil and ash sampling within and near the burn areas, and these test results will be shared publicly. These measures are in place to protect the health and safety of residents, workers, and surrounding community as cleanup continues. All right, next slide, please. In addition to these protective measures, we are conducting a comprehensive environmental assessment to better understand the risks posed by fire-related contamination. This assessment will help answer critical questions, including what hazardous substances are present. Testing will identify heavy metals, asbestos, volatile organic compounds, or VOCs, and other harmful pollutants in the air, soil, and water. To answer how contamination levels changed over time, we are analyzing data across 3 key timeframes. The first is baseline environmental data, which provides information on air quality, soil composition, and water safety before the fires. This serves as a reference point to determine what was already present versus what may have resulted from the fires. The second is immediate post-fire conditions, assessed through testing conducted right after the fire to measure initial contamination levels from burnt materials, structures, and vehicles. This helps identify high-risk areas where hazardous substances like lead, dioxin, PAHs, and asbestos may have deposited. It also informs immediate public health guidance on protective measures. The third is ongoing trend data over time, which is essential as cleanup efforts continue to monitor how contamination levels shift due to factors like wind, rain, and runoff. This helps determine if additional remediation efforts such as soil removal or further air and water testing are needed to protect public health. As we continue to gather and analyze data, our focus remains on ensuring that residents have access to clear, timely, and actionable information. This commitment extends beyond immediate response efforts and into the long-term recovery process. We are committed to transparency and science-based guidance to help residents stay informed and safe. Assessment results will be publicly available on the Los Angeles County Post-Fire Air, Soil, and Water Assessment Plan website, where residents can access the latest data and public health updates. Finally, I want to extend my deepest thanks to our local, state, and federal partners, research institutions, and public health teams who are working tirelessly to support this recovery effort. Your collaboration is essential in ensuring that we rebuild in a way that prioritizes health and environment protection. Thank you.
Thank you so much, Dr. Quick. Our second speaker tonight is Dr. Jason Lowe from the South Coast Air Quality Management District, AQMD. Dr. Lowe and his team play a critical role in monitoring air quality and assessing the impacts of wildfire smoke and airborne pollutants. He's going to provide an overview of the different types of air monitoring being conducted, what AQMD has observed so far, and how this data is being used to inform public health recommendations. Welcome, Dr. Lowe.
Great. Thank you very much, Dr. Ferrer, and I appreciate the opportunity to speak tonight to discuss our efforts. Our thoughts are those with those who are rebuilding their lives, and we are focused on your public health and are able to provide information on the baseline data, immediate post-fire, and ongoing data over some time with regards to the air quality that Dr. Quick spoke of just earlier. So South Coast AQMD continues its expanded air monitoring plan, which consists of both mobile survey measurements and stationary air monitoring deployments. A second round of mobile measurement surveys were completed in the Eaton area on February 19th and the Palisades area on February 21st. These surveys evaluated for air toxic metals and gaseous air toxics as these platforms drove through the neighborhoods. Mobile surveys provide a snapshot in time and do not sample long enough to at a location to establish risk to human health. However, they are able to evaluate if elevated level of pollutants are present as they drive by, and if the data show some of those hotspots, they can also be considerations for stationary site placement. Results of the mobile platform studies were published last week on our website, www.aqmd.gov/LA wildfires. So the results of the most recent mobile survey in Eaton indicated that the levels were mostly within background levels for the majority of the data. However, in some locations, lead, arsenic, total chromium, and nickel were above background levels. And then for one very brief moment, there was elevated measurements of benzene. However, our team did go back to that area, and that area did not show that elevated levels of benzene anymore. Our measurements also showed no elevated levels of methane. If you looked at our first measurements, we did see some elevated levels, and they were no longer there in this run. So going over to the Palisades, the results were within background levels for the majority of data as well. However, similarly, in some locations, lead, arsenic, total chromium, and nickel were above background levels. And also there were some slight elevated levels of methane. Our investigation into the potential sources of methane is ongoing. Moving on to the stationary air monitoring, now all 5 sites, total between the 2 fire areas as part of the expanded air monitoring plan, are fully deployed. These measurements are for large particles indicative of dust, and also particles that are smaller and then go deeper into the lung. We also are measuring for air toxic metals and other elements. And lastly, we're looking for airborne asbestos. So when we look at some of the data, we have 3 sites that are set up now. One is near the Altadena Golf Course, which is near one of the processing zones. We have 2 other sites, the Christ the Shepherd Lutheran Church and Fire Station 11. Some of those sites were in the areas that showed some of the elevated levels of the second mobile survey. And the results are available on an online dashboard, and you can get to that dashboard using the website I mentioned earlier. Getting to the results of that, the results of the site that's near the Altadena Golf Course did show metals and that were within typical levels, and then all the asbestos samples were non-detects. The particles, both large and small, were both all well under federal standards. And then we anticipate the results from all 3 sites early next week. So switching over to the Palisades area, at the site that's in the vicinity of the Will Rogers Beach, for the samples that we were able to collect starting from February 21st, the metals, arsenic, lead, manganese, nickel, and total chromium were above typical levels. We did work with our health partners, LADPH and the California State Health Departments, to evaluate this data, and the conclusion is that these levels do not pose an immediate health risk. Metal levels that were observed on the 27th at the site were mostly lower than those observed on the 24th, but they were still elevated. The new site was deployed at Fire Station 69 and collected its first sample yesterday. So we'll have those results early next week. So as a conclusion, we'll continue to post the results as they become finalized and work with our state and health partners to make sure that you have the best available data and messaging to date. And again, the results can be found at www.acmd.gov/LA wildfires. With that, I'll pass it over to Dr. Ferrer. Thank you.
Thank you so much, Dr. Lowe, and we appreciate it. I appreciate your giving everyone the website again. I think people will be relieved to know that you're both that you've completed some mobile monitoring and that you now have the stationary air monitoring in some very particular areas. So thanks for sharing that with folks. And again, I encourage people to go directly to AQMD's website because they do update their information every day there. So it's a good site to look at, and you can look at it by the burn areas. So I think it will give people very helpful information. Thank you so much. Our next speaker is Dr. Allen, who is the Associate Professor of Exposure Assessment Science at the Harvard T.H. Chan School of Public Health. Dr. Allen and his team are leading indoor and outdoor air quality testing as part of the consortium's wildfire assessment efforts. He will discuss what they're testing for, the methodology that's being used, and how their findings can help us better understand exposure risks in homes and communities affected by the fire. His expertise in environmental health will provide important insights into airborne contaminants and mitigation strategies for all of the residents as you're recovering. Thank you for joining us tonight, Dr. Allen.
Thanks for inviting me, Dr. Ferrer, and my thoughts with everybody in LA facing this devastating fires. I'm proud to represent a group of scientists at the universities listed on the screen here that are part of a research consortium. The scientific community is mobilized to provide independent research and data to the community and to the Department of Public Health and everyone else on these critical topics that everyone's asking about. I'm going to describe a little bit of the work we're doing and even share some of the early results we found. And my hope tonight is I can be a resource to you. And you can go to the next slide, please. So the consortium has really two large aims as I think about them. The first is asking questions people want to know about. Is it safe? So what's in the air, water, soil, and dust? And these are the 10 activities related to that first question that are on the screen. We're going to model things like fuel loading, emissions from the site. We have mobile measurements as well, not to be duplicative with South Coast monitoring, but also to be supportive and in addition to what's already being measured. We're doing studies of surface water transport flows so we can see how contaminants move off the site. We have some work looking at firefighter exposures. And we have a 50-home study underway where we're monitoring air, water, dust, and soil for things like VOCs, metals like lead, particle levels, PAHs, arsenic, asbestos, some nanomaterials, microplastics, so a wide range. We have air quality monitors in over 1,000 locations, and we will be reporting on this over the coming year, measuring both indoor and outdoor. And 10th item here is, of course, we want to be sure we're sharing all this information with the public. You can find this at our website at lafirehealth.org. The second part of the study I'm not going to talk about tonight, but all this information feeds into a larger 10-year planned health study. So right now we're focused on understanding what's in the air, water, soil, and dust, and that'll feed into an ongoing health study. Next slide, please. I want to share some of the data that we've now released on this website. And the first 3 slides I'm going to show are around particle data from mobile monitoring and indoor measurements. This is data from mobile monitoring in mid-February, both in the Altadena area and the Palisades area. And generally what we find here is that the levels of particles, and this is PM1, the levels of particles are generally within EPA limits. There's no EPA limit for PM1, but within the limit for PM10, PM2.5. They're consistent with the other regional monitors that are out there. They're consistent with the measurements made by South Coast, and they're quite typical for the region. So I think, at least in the snapshot, this is good news. Our mobile monitoring from our consortium took place over 3 weeks. The van will return this spring for 3 weeks and over the summer for 3 weeks again. Next slide, please. Additional mobile monitoring by our team found similar results related to particles, this time PM 2.5, again, generally within the EPA 24-hour limits, consistent with the regional monitors, typical for the region. And what we're showing here, I think, is one interesting aspect of the mobile monitoring here was the particle levels before and after the rain. And as expected, if you look at the graphs on the bottom, the particle levels are much lower after a rain event, which we know is consistent with all the other science that's out there. Next slide, please. We also have PM data, particle data for homes, and we broke this out into, this is a couple weeks of data for particle levels in homes. On the left, homes in the burn area, to homes that are adjacent to the burn area, and homes that are then about a couple miles away from the burn area. Generally the same findings. Particle levels are within the health-based limits. There are occasions when they go over the annual limit, but they're generally consistent with what we would find indoors, and consistent or lower than outdoors. That said, I want to share some new data we released just this week on what's happening in the burn zone when there's activity taking place. So the data look good, at least on the particles. But if you go to the next slide, I want to share some of the particle data from our team looking at levels indoors and outdoors in a couple different homes with high precision scientific instruments looking at particle levels, highly resolved particle levels. So the 3 homes, it's only a couple homes. So we have to be careful what we can generalize here, but we thought it was important enough to get this information out to the community. What you see here are house 1 and house 2 are in the burn zone. House 1 didn't have damage. House 2 had significant damage, and house 3 was further outside of the burn zone without damage. The dotted line represents an indoor-outdoor ratio. And what you can see in the home that had the most damage, the home in the middle, home 2, the particle levels indoors are higher than outdoors. And in particular, when they had activities taking place, including cleaning activities, turning on the HVAC or air conditioning system, we saw an increase in the particle concentration such that they were about 2.5 times higher than outdoors, which indicates that we know in these homes that are impacted where there's settled soot and ash and dust, activities are going to stir that up and create elevated exposures, has the potential to create elevated exposures indoors. Next slide, please. Similarly, we looked at indoor-outdoor measurements of several VOCs, and all we're reporting here is a specific VOC that is a marker for fires. It's very specific to fires, not something we see outdoors or in areas that aren't impacted by fires. And here again, in homes 1 and 2, which are inside the burn scar area, we saw these VOC levels at 4 to 5, even up to 6 times higher than outdoors. Again, this is a VOC that's a specific marker of burn emissions. And again, we saw higher levels when there's activity taking place in the house. The third home had some indication it was outside the burn scar area, not a lot of visible damage. There was some impact, of course, during the fire event with settled smoke, but the levels were lower.
Joe,
Yeah.
you might want to explain what VOCs are.
Sure. So VOCs are a gas, what we call volatile organic compounds. These are gases that are can be really common. These are things that come off of cleaning products, but they can also be quite toxic chemicals like benzene, maybe you're familiar with. And in this case, we didn't list the specific VOC, but it's called furan. And furan is just a specific marker of emissions from after a fire. So the key message that we wanted to share here is that some of these gases or chemicals that are specific to fires were much higher indoors, particularly in homes in the impacted area. All of that is important because I was on the site with the sampling team and seen this, and many others have seen this too. Haven't seen a lot of people taking precautions or not always taking enough precautions, but it's very clear to us anyway that there's a signal inside homes that were impacted of both elevated particles and elevated chemical levels, particularly when there's a lot of activity happening. So if you go to the next slide, please.
Joe, one thing just before you move on, do you want to let folks know when you did the sampling for data set 5?
Sure, this was just same time frame, about mid-February.
Okay, perfect. Thanks.
Yeah. We're going to release a lot more specific information. We were going to hold it and release more information on specific chemicals, but we thought this information could get out because it's quite important for people to be aware, as you heard everyone else say, that we believe precautions should be taken in impacted homes. My Healthy Buildings team at Harvard put out some guidance on what you can do right now, consistent with what others are putting out. I think there are 3 things that everybody should be doing. You should filter the indoor air. That means upgrading your filters in your central mechanical system to what's called a MERV 13 filter or higher. Use a portable air cleaner with a HEPA filter. And if you're in the impacted area, you can consider a portable air cleaner that has both HEPA and a carbon-based filter. 2, you want to control the dust. Kick off the shoes when you're coming in the door. Prevent tracking in soot and ash. Should be damp wiping surfaces, not dry wiping. And use a vacuum cleaner that has a HEPA filter if you can get your hands on one. 3rd thing that's quite good idea if you can get access to it is to monitor the air quality inside your home. There are now lower cost air quality monitors that measure airborne dust or airborne particles, measured as PM 2.5. And you can also measure airborne chemicals, measured as total volatile organic chemicals, or TVOCs. One last slide. We put out some guidance too on the types of respirators. So I think, as you know, or may know, or may be familiar with, an N95 mask is very good at capturing airborne particles, but it actually does not capture gases. So if you're in a highly impacted area, particularly if you're doing cleaning work and you're encountering soot and ash, I would recommend a P100 and multi-gas mask. And what that means is that's the top layer mask with the pink cartridges there. It's going to capture both particles and airborne gases. It's also going to be resistant to oils. And we have some color-coded guidance here on the type of cartridges you can use. You can find this on our website. Last thing is the link to the website on the last slide here. If you have any questions, all this data is presented on our LA Fire Health study. Oh, there's a lot more coming next. You can go to the next slide. All the data I shared is going to be on that website. All the guidance is on that website. And this is where we're going to be posting a lot of new data. We have new data releases coming out this week and the following week, and continuing as the data become available to us. We're going to share them with the public. So thank you.
Yeah, thanks so much, Dr. Allen. And I want to thank the entire consortium. They've been great partners and really very rapidly mobilized to support our communities. We had so many requests for data and for information about what's going on. So thank you for all your leadership and the entire team for mobilizing to help people in LA. Much appreciated. Our last speaker tonight is someone I'm really pleased to introduce. It's Dr. Love from Rue Associates. Dr. Love is leading soil testing efforts on behalf of the Department of Public Health as part of the wildfire assessment. Dr. Love and his team are analyzing contaminants in fire-impacted soil, including heavy metals, dioxins, and other hazardous substances. He'll discuss what they're testing for, the methodology being used, and how this data will help determine potential health risks. His expertise in environmental forensics and soil contamination will provide key insights into how we assess and mitigate soil hazards in affected areas. Welcome. We're glad to have you with us tonight, Dr. Love.
Great. Yeah, and we're grateful to be part of the team, right? Having a meaningful role in the recovery after these fires is something that we're really appreciative of. As Dr. Ferrer said, our involvement is really trying to answer and fill some of the data gaps of the questions that really have evolved naturally in terms of residential soils. There's lots of questions about what should I be doing about my soil? Is it impacted? And there's a whole range of different situations that people are in. And so our soil sampling is really focused on answering the question of what are the fire-related soil impacts that are reasonably expected based on where your location is in each of the fire zones, as well as the parcel condition itself. And so, there are thousands, right, of impacted parcels. So we are not sampling each and every parcel. What we're doing is doing a representative sampling of soils in each of the different fire zones. Representative being a few hundred parcels in each of the fire zones that are distributed. In those soil samples, we're measuring the things that are known to be part of these sorts of fires. We're measuring the heavy metals, including arsenic and lead, which are usually the sort of leading heavy metals. We are measuring PAHs, right? Stuff that naturally comes, polyaromatic hydrocarbons, which are sort of naturally part of ash. And we're measuring dioxins as well. And so all of those things are going to be part of our analysis. But we're not just, sort of treating every data point the same. We're going through and trying to see if there are differences in the soil concentrations of those chemicals based on the parcel conditions. And so we're looking at parcels that are categorized as destroyed. We are looking at parcels that essentially have minor or are categorized as either minor or affected damage. We are looking at soils in areas where there is no damage within the fire zone, right? But they're adjacent to other properties that may have damage. And then lastly, we're looking at homes that are outside of the fire zone within a couple miles that would have still necessarily had smoke come across their property. We've heard from the community in all of these situations where they're interested in having a better understanding of what the impacts are to their property. So we're trying to gather the data to help fill that data gap to say, hey, here's what we're seeing that's common among these locations and these parcel conditions in each of the fire zones. Next slide. Now, when I say parcel conditions, if you haven't seen this or you don't know, each of the parcels has been characterized by the recovery group as to, destroyed, medium damage, minor damage, affected. That's what we're using to sort of categorize the parcels that we're going to and taking samples. You can see here sort of what the distribution of those different types of damage, parcel conditions are based on the color coding. If you go to the next slide, you can see how we're handling is we are essentially gridding the fire zone, and then we're going to go into each one of those cells, each one of those boxes, and we're going to try to get 5 to 10 of each of the different types of both minor and affected homes and no damage homes in each of those parcels to try to make sure that we have a good data set as to what are sort of the parcel conditions, the soil conditions for those contaminants, and do that across, in this case, the Eaton fire zone. If we move on to Palisades, right? Palisades obviously has a different distribution. You can see, they have a, sort of cover a larger area of the overall fire zone in terms of where there are parcels, and they have more of a distribution of different types of damage. Again, we're going with these characterizations of the parcel conditions and trying to, once again, sample across the cells that were created. So if we go to the next slide, you can see we've gridded the Palisades fire zone. And again, each of the green boxes is an area that has parcels that are sampleable, right? That aren't just wilderness, that we're going to target to, again, try to get 5 to 10 of the sort of minor damage and no damage homes in each one of those cells. When it's all said and done, we're going to pull this data together and try to see where there are commonalities and differences, both geographically and with parcel conditions, so that it will allow and inform homeowners some expectation for what they should be expecting by matching both their location and their parcel condition to the data that we're ultimately going to be able to report out.
Thank you, Dr. Love. I have a couple of questions I wanted to ask you before we move on to some of the other speakers. But I know that everybody's question, because I've already seen a bunch of questions come in, is when are results likely? Like what's the timeline? We've already said, people can go to our website, all this will get posted, but I'm wondering what your sense is of timeline, at which point you'll start posting some of the results on the soil sampling.
Right. So we started sampling about 10 days ago. We should have at least some of the early samples. We should be able to report out on those in the next week or two. And I'm expecting that we'll have a full data set in, probably 6 weeks, 8 weeks.
That sounds great. And we will invite you back in a couple of weeks to talk through your preliminary results so folks can actually, hear about what you found and also ask you some questions. That's the purpose tonight. But just a couple of questions. And again, I want to thank everyone for sending in their questions. Remind people, go into your chat if you have questions you haven't yet sent us. But I think this is a question that a few people have asked. What toxins specifically are found in ash and contaminated soil?
So, there's obviously this is not the first fire of this type. Previous fires have documented the heavy metals and PAHs as being the primary.
You might want to give
contaminants.
more details
Yeah.
on like what that is.
Right. So heavy metals include things like lead and arsenic, sometimes chromium or hexavalent chromium. Those are all metals that have been seen in other fires. PAHs, again, polyaromatic hydrocarbons. Those are organic molecules that get formed essentially when things burn, like they get formed when you grill. They're the smoke that, part of the smoke that comes off during a bonfire. So those chemicals are also seen in these sorts of fires, typically in the ash. And then the last is dioxins. Dioxins are a chemical that can be, depending on its form, particularly toxic, and can form under the right conditions if you have sort of chlorine and the right temperatures and organic matter. There's a potential to form dioxins as a hazard as well, and so we'll be looking for that as well.
That sounds great. One more question, and it's going to take me a while. I want to read the whole question from the person who sent it in. My home in Altadena survived the Eaton fire, but our detached garage and neighboring homes on each side burnt down. We vacuumed dust samples from inside of the home and had them tested by an environmental hygienist. They returned with high levels of PAHs, lead, arsenic, nickel, cobalt, and fire retardant. The highest levels were for arsenic, lead, and PAH. We assume there must be elevated levels in our yard if these levels are elevated inside our home. Should we be thinking about removing 6 inches of soil from our entire property? If we test our soil, is there a standard that's considered acceptable? And I'm using that.
Lots of questions.
We have like
yes.
20 questions that are very similar to this.
Right. So as this question brought up, right, the main things were lead and arsenic and a few other metals, as well as PAHs. That is consistent with what is seen in other fires. Having had some indoor measurements, right, so you see that they're there, but whether or not the impacts to the soil are significant really requires some degree of testing, which is exactly the data gap that we're trying to fill, right? The parcel that you described where the house is intact but an outbuilding is burnt, that would likely be characterized as a minor damage parcel. And so hopefully that we'll be gathering some data that'll help put sort of representative soil numbers for that type of parcel in perspective as to what sort of impacts we see.
I think one of their important questions was, if we test our soil, is there a standard that's considered acceptable? Because we have other people asking that as well.
Sure. I mean, there are some standards that are out there. EPA has what's called residential screening levels. Those are very, very conservative screening levels for a whole range of different contaminants. But what they don't take into account are things like what's the background level in Los Angeles area, right? What are other sources that also could have contributed these things to soils? And so, I mean, ultimately, every parcel is a bit unique. Again, that's why we're trying to collect representative soil samples. But ultimately, folks have to make a decision on an individual basis.
Yeah, thank you. Thank you so much. I want to just let all of the folks that are joining us tonight know that there are 2 other folks who have joined us just to answer questions One is Dr. Olivares, who's the Assistant Professor of Civil and Environmental Engineering from the University of California in Irvine. He's going to help with some of the responses to your questions about water safety. And Dr. Davis, our health officer here at the Department of Public Health, has also joined. Dr. Olivares, if I could go to you, there are some questions here in general questions about sort of ocean water safety and beach safety. This question is, can we swim in the ocean now? And are our beaches going to be safe in the summer? People are making plans. They want to know if kids can go to beach camps. So I don't know, and welcome, Dr. Olivares. We're so grateful you're here with us tonight. I don't know if you want to start by answering that question.
Sure, absolutely. And thank you. Thank you for having me. I think in general, anytime there is a storm event, it is recommended to avoid swimming in the ocean. Maybe I think the recommendation is usually 3 days or close to 72 hours after a storm event, just because we get a lot of runoff coming out, right? So when we think about fires, then we have all these particles that we're talking about, those ashes, the potential of those going into runoff and eventually going to the beach. I think another component as well is that once those materials get moved into the sand, when we are recreating in the beach, in the ocean, it's important also not to disturb the sediment, right? So I think those are the two considerations I would suggest. I think thankfully also during the summer, that tends to be more of the dry period in Los Angeles and Southern California. So I think that hopefully that'll be less likely of a storm that could encourage that runoff getting into the ocean.
Oh, thank you. Thank you so much for that. Dr. Allen, I mean, I'll start with you. Anybody can join in. I think you all have some advice on this. Could you speak to the issues for residents who still have homes standing, especially curious about what kind of environmental testing should be done inside someone's home?
Yeah, I think that's a good question. I think for those who have the resources to do testing, we can talk about what needs to be done. But I would first reiterate the kind of control strategies we talked about that are effective regardless of what the specific gases or chemicals or particles are going to be in the home, right? Whether it's asbestos or lead or arsenic, the control strategies I mentioned are going to work pretty much for all of that. And that's basically make sure you're filtering the air with a good HEPA air cleaner. And by the way, the Harvard Healthy Buildings Program has a tool that helps you pick an air cleaner for the right size. I can give some more guidance on that. Make sure you're upgrading to the MERV 13 filters if you have a central system, if you're in an apartment building, and using a vacuum with the HEPA vacuum. Some of these control the dust strategies. That said, if you're going to do some monitoring, the things I would recommend trying to find one of these lower cost. I'm not saying low cost, but they're expensive. They're maybe $200. But they're sensors that you can have in your home that will measure airborne particles and airborne gases. These are not high-grade scientific instruments, but it's a way for a consumer, a person, to get a sense of what's happening in the home. And if your particle levels are good and your VOCs, these chemical levels, are low, at least you have some sense of what's happening in your space, because everything else is these scientific instruments that can be far removed maybe from your home. So I like the idea of these basic control strategies and then measuring what's in your home. If you're going to hire somebody, I'm a certified industrial hygienist. If you're going to hire an industrial hygienist, the things I would look for that I think are reasonable and most people can measure, I would look for metals, because clearly there were emissions of metals during this fire that we saw many, at least 20 miles away from the burn areas. So I would measure for metals, particularly look for things like lead. This is relatively lower cost for monitoring. You could measure other VOCs. So if you hire a good industrial hygienist, they'll tell you can take a VOC sample, an air sample, they send it to a lab, and they'll tell you not just generally what chemicals, they'll tell you specifically what's the benzene level. Is it at a high level or bad or not safe? I think that's where I'd really kind of focus. There are other things you could do. You could look for things like asbestos and PAH, as we've been talking about. But for me, trying to keep it simple, I'd focus on the controls first and foremost, the lower cost air monitoring for particles and gases. And then if you're going to hire a hygienist, make sure you look for some of the metals and VOCs. That's what I'd recommend.
Now, I'm going to ask you a follow-up question, Dr. Allen. My home, like many, has elevated levels of lead now in all the rooms. What's the science on what can be cleaned or what needs to be replaced?
So, you're going to have a lot of the dust and certainly the gases will absorb into any porous materials. I think here again, it's, if you have resources to swap out some of these porous materials, but I like to operate on the assumption that people may not be able to do these kind of things, right? So again, if you're controlling the air and dust, some of these strategies so that anything that is settled does get picked up in the air, kicked up, at least you're capturing them through these little portable air cleaners and you're kind of controlling it that way. I do think it's very important, and it probably doesn't get as much attention as some of these HEPA air cleaners do, that if you are in an area that was impacted and you saw soot or ash, or even if it's a highly impacted area, to get a vacuum cleaner that has a HEPA filter. This is long-standing guidance for homes that are impacted with lead dust, unrelated to fires. I'm in the Northeast. We have a lot of homes impacted from lead-based paint. That's because a typical vacuum will pick up large particles from the floor or on materials, and then it'll capture the large ones, but it'll redisperse sometimes into smaller particles in the air. And this is well known for lead. So make sure you have a vacuum that has a HEPA filter so you're picking up the big stuff, but also capturing the smaller particles that they just get re-exhausted and ends up in a plume in your house. I think that's really important guidance, particularly for homes that are impacted with soot and ash. You might have lead around. So look for a vacuum cleaner that has a HEPA filter, particularly one that's air sealed. I can put some links out there if people are interested in where to find these.
Yeah, I think that would be really helpful. Thank you so much for that, Dr. Allen. Dr. Lowe, we have some questions about sort of air monitoring, air quality monitoring. We have some very particular requests about certain places. So one is really has to do with air quality testing at the disposal sites. These are the sites where I'm pretty sure what folks are referring to is where phase 2 fire debris is being taken. We have a particular question on Sunshine Canyon. Is there any capacity for AQMD to be doing some testing at the landfills?
So, I mean, I think I've first stated that our focus has been to deploy air monitoring and provide that information to the areas where there's all this uncontrolled debris right now. And I think, we just mentioned that we're fully deployed to be able to provide that information in the communities where, there's a lot of activity going on. There's a lot of repopulation activities going on that are kicking up dust and debris. We're seeing some, levels of pollutants that are a little higher than normal for some of these areas. So we've been fully focused on looking at the data for those areas and doing the air monitoring there. The thing in terms of where the debris is going, it has a control process in terms of the U.S. Army Corps of Engineering. They have a process where they wrap it up and then it is taken to a controlled area where it's a permitted landfill. They have processes who are involved with taking this debris, taking water mitigation on it. They have actually inspectors there to view to make sure that it's being watered down. We have our inspectors that go out there to check to make sure that the practices are being conducted appropriately. So that allows us to focus in the areas where there's not that control there as much. So very much we're focused on the protection of the health and evaluating the air quality information in the communities that have that more uncontrolled environment at this point.
That's really helpful.
But you did mention Sunshine Canyon?
I did mention Sunshine Canyon.
Okay, so
I have about 10 people asking about
yeah, so
air monitoring.
with regards to Sunshine Canyon, so there has been air monitoring at Sunshine Canyon. Facility actually runs, they have an air monitoring contractor who runs air monitoring. We've reviewed some of the plans in terms of the technical details of that and have looked at the data occasionally. But they do have 2 air monitoring stations that are there. In the past, they've done PM and chemical called black carbon, and they also have meteorology to evaluate kind of for the past few years that data. And I think the county right now is moving towards looking at expanding parts of that as we speak.
Yeah, thank you so much. I think that was really helpful. And again, I want to just reiterate that there are a lot of requirements in place at the disposal sites. I mean, these are licensed disposal sites. And in fact, at both, at all of the sites actually that are accepting fire debris, we do have additional inspectors there. Either the company running the site, or in the case where we're the LEA, we have extra folks that are inspectors that are going to be at those sites. Again, trying to make sure there are protocols in place, and we want to make sure everyone's following them. But we do have a lot of questions, and we hear loud and clear that people don't want to just know that there's monitoring. They want to figure out how there's access to that information. We'll take that back to our partners who are working at all of the disposal sites, try to get some answers for that. Dr. Quick, I want to go to you for just a second, because, of course, there's a lot of questions about this, and this came up last time, and I know it comes up at some of the press conferences as well. Will there be soil testing after the Army Corps completes its work at a site? So the Army Corps, remember, does phase 2. Phase 1 has been completed. The EPA, where it can, has removed the hazardous waste, and now the Army Corps is on properties where they've got a right of entry permission, really doing what's called phase 2, getting rid of fire debris. But there are questions here about, will there be soil testing on each site after the Army completes the cleanup of fire debris at that site? And if there are still toxins in the soil, is there a plan for remediation?
Yes, those are great questions, and one that comes up quite frequently. So the federal government has tasked U.S. Army Corps with the phase 2 cleanup at this at both the Eaton and Palisades. And essentially what U.S. Army Corps has determined is that they are going to go down 6 inches. So they're going to be removing 6 inches underneath the ash footprint, and all of that will be taken to the landfill in the manner that you just heard described, with those measures in place to get the disaster debris to the landfills in a manner that is meant to keep that from spreading in the community and in the transport process. So as of now, U.S. Army Corps is not doing confirmatory testing after the cleanup of phase 2. And then the question related to what might be left as far as toxins, I do think some of the testing that you heard Dr. Love speak to can help inform some of the decisions as we get results back on what might need to be done post cleanup in areas and in areas that have these other impacts, so that we can really tailor the public health advice related to what that might be.
Yeah, thanks so much, Dr. Quick. And this would be a question probably for Dr. Quick or Dr. Davis. There are questions. There are people who have joined us tonight who have young children, and they want to know what's a safe distance from debris removal activities. So they're living in neighborhoods where around them there are debris removal activities going on, and they want to know if we have any advice on what's a safe distance from debris removal for children's activities that may be taking place outside. Dr. Davis, thank you for joining us. Do you want to start?
Yeah, sure.
Okay.
Yeah, I definitely can start. So it's a good question, but it's a dynamic situation. I think the things you have to consider are, how close you are to, the source of ash, soot, and, fire dust in terms of cleanup and where the stage of cleanup where it's at. You also have to pay attention to the wind. So if the wind is blowing pretty strong, or if you're downwind, there's a chance that any of that stuff can be blown. So it makes it hard to determine, exactly a safe distance. I think there are a number of factors to pay attention to. Again, how close are you or the child to burned structures? What's the status of debris removal, for those structures? Which way is the wind blowing? And how much there might be some direct contact with ash, soot, or fire debris. Understanding that the closer you are, the higher the wind is, and the more downwind you are, the higher your risk is going to be. So complicated, but not a straightforward question. But those are the things to consider in terms of where you would have an increased risk.
Dr. Quick, I don't know if you wanted to also jump in. You good?
Yes, yeah, I'll just add, I agree that it depends on sort of the conditions surrounding and the only other thing I would add is we do ask folks to be aware of what they're seeing, any particles in the air, any ash or soot that you're actually noticing in the environment is a clue that you need to be taking precautions. And we do always err on the side of extra caution related to kids. And so we do in general have messaged that for some people not being in the area or near areas until after phase 2 has been completed might be advisable for some, and taking extra precautions with kids is always a great idea.
Thank you. Dr. Olivares, I'm going to go back to you. Just we have some more questions that came in around water. One very basic question that we got from a fair number of people is, how can homeowners test their water for contamination? Are there commercially available kits that would do this?
I think especially following fires, what has been observed in the drinking water distributed through water agencies is in some cases the detection of benzene and other volatile organic chemicals that are coming from either the combustion of plastic infrastructure or just from the water distribution system losing pressure and soaking up those chemicals into the water. In terms of testing, I think it is important to connect with a testing lab that is commercially certified, because many of these chemicals are short-lived. That means that the storage is important. In order to preserve the sample, it has to have a short turnaround. So ensuring that when connecting with a testing provider, they offer testing specifically maybe benzene, that's one of the contaminants of concern in drinking water, or other volatile compounds that is that connection. It's as far as I've seen, I haven't seen kits that might be available to directly test at home that have the level of resolution of detection that we would like. So for example, the state maximum contaminant level, which is the level at which it's deemed above which is deemed unhealthy, is 1 microgram per liter for benzene. That level is low to detect on a test at home kit. So I think I recommend testing with a commercial lab.
I'm just going to follow up, Dr. Olivares, because we have a lot of questions about what is the municipal water system required to do on testing. If I'm connected to a municipal water system and they say that the water is safe, is the water safe? Or do I have to worry about, this is multi-part question, sorry, or do I have to worry about the fact that the water coming out of the system is safe, but that there's been damage to things in my house because of the fires that may make the water not safe when it comes out of my faucet?
Mm-hmm. As far as I know, the testing that's been conducted is following the pipe distribution network from upstream all the way down, testing for benzene. And when there's a detect about the state maximum contaminant level, the pipes are being flushed. That's the practice that has been proven successful. Similarly, I think at home, if the water hasn't been used, and when you return to home, people return to home, it's a good idea, I think in general, good practice to flush, because many times you have stagnant water that might be seeping in if there's any residual chemicals. Some people might may choose to have a filtration system, and for these chemicals, a carbon-based filter it could be a good idea. Similarly, I think if you already have a carbon filter, it's a good idea to make sure to pay attention to how often they should be changed, and a fire is a very drastic change in possibly water quality. So I think changing is a good idea if possible. But if you want to test further your home, if you are concerned, if the piping infrastructure at your home, you're concerned that it has been impacted, I think testing would be a really good idea. And I think the recommendations have been to allow for flushing your water lines at least 5 minutes, if not longer. And if you have a water heater, to just let it flush until the water is no longer, like, it becomes cold again. Same thing, replacing filters for refrigerators and cleaning ice making machines as instructed by the manufacturers. So I think all of those actions can help protect from possible impacts from volatile chemicals to drinking water.
So this, I mean, I've got so many questions, and you kind of touched on them, but let me just make sure we've got some clarity. Is one of the reasons why folks are worried about this because smoke and soot can enter the water pipes?
So
Like,
there's
this level of contamination that you're talking about, I think there's a lot of confusion about where that comes from. Does that come upstream, or is that something that happened because your house was near a burn area, or, you know, partially there were parts of your property that partially burned?
Mhm. I think that there's two lines of thought. This is a new phenomenon that was first detected in the Tubbs fire in 2017 in Northern California, right? So one idea is that it's because of we have plastic infrastructure, like plastic pipes that distribute water, and if they are impacted, burnt, or just thermally impacted, that they can essentially leach out chemicals. The other thought is that during firefighting activities, our water systems might lose pressure, creating like a vacuum, and it can soak up the maybe some smoke chemicals. Now, the impact from that we see in runoff and debris, that wouldn't necessarily get into the drinking water system, because that water goes in a drainage system, and in the majority of cases goes into discharging in the beaches and the oceans if there's maybe some treatment in between. But the drinking water does go through the water treatment system and then the distribution lines. So I guess the question is whether the impact is between the water leaving the water treatment and arriving to the home. So those are the main thoughts about why these issues might arise in drinking water.
So that was so very, very helpful, and we'll come back. We'll try to come back because we do have a lot of questions about water. So I want to really appreciate that you joined us tonight. I'm gonna go back. I think let me start with Dr. Allen, but Dr. Love, you might jump in as well. There are a lot of questions about again, protocols that people should use for cleaning household items that were exposed to contaminated debris. And any advice you can just offer, because, you know, there's people who are noting, you know, I only got $20,000 back from my insurance. My house had a lot of smoke damage, there was a fair amount of ash and soot in it. Am I needing to throw away everything, or are there ways for me to be cleaning, some of these household items that were exposed? So I don't know, Dr. Allen, we could start with you, Dr. Love. We're looking for the experts to weigh in, because there are a lot of questions about this.
So I guess I'll start if that's helpful. I think, with indoor cleaning, the things that are going to hold on to these contaminants the most are really the textiles, anything with fabric on them, right? There are ways to clean them in terms of, being able to do, HEPA vacuums, as Dr. Allen had referred to earlier, or, types of scrubbing the fabric. But those are going to be the most difficult to get, sort of 100% clean, right? Hard surfaces are about wet wiping and cleaning. Anything with a hard surface, removing it is more straightforward. But it's really the textiles that are the ones that are going to be the most difficult and the most problematic.
Yeah, I agree, and it's challenging, right? So if your home is highly impacted, you saw a layer of soot and ash, and any of these materials that are porous, like a couch or anything with fabrics, a non-leather couch, if people aren't always in the position where they can dispose of these, maybe didn't have the insurance money for it. But if you can, I think these are going to be hard to fully clean, to be totally frank. If you're in the position where you can't do that, or something's a particular keepsake, or I think some of the vacuuming the surfaces to capture the particles is important. The other thing to think about is that if you're smelling something in the house, like smoke related, that's the slow off-gassing of VOCs, these gases that have absorbed into the materials, the couch cushions, or even some clothing. And it's going to be a slow re-off-gassing that could take place over weeks or even months. And so in that case, this is where the strategies we talk about become really quite important if you keep these materials in-house. One, you want to clean off the surfaces frequently, make sure you're capturing any of the dust that's on top, of course. Two, make sure you have these air filters going. You can also have an air filter that is a HEPA filter plus a carbon filter. The HEPA filter captures particles, carbon filter captures gases. These are very expensive, and you need a lot of carbon to help capture any of these gases. So in the absence of that, you want to make sure you're also ventilating the house. Right. So then it becomes this kind of trade-off. Well, what's happening outside the space? But you want to be sure if you're smelling that, you have time for these materials to off-gas and they're not concentrating in the house. You want to have a combination of good airflow, good filtration, either HEPA filter plus the carbon filters if you can afford that. And also, this is where I think the monitors I mentioned earlier are important, because that will let you know, well, when can you actually keep the windows open and bring in some air, so you're kind of ventilating that space and not allowing the buildup of these gases that they re-emit from these surfaces. Last thing I'll mention is something I made in my comments. If you're going back into one of these homes that's highly impacted and you can smell something, that is the off-gassing of these gases and these VOCs. You should absolutely be wearing the protection, not just the filters, not just HEPA vacuuming, but you should be wearing respiratory protection. In my view, you should have the combined particle mask plus gas cartridges. The things that look like a painter's mask, look for the pink cartridges, and maybe the olive gas cartridge. We have some guidance on our website to help you pick the right respirator.
Are you suggesting, Dr. Allen, that they wear those for cleaning in the house? Or are you suggesting that as long as they continue to, sort of have I call it the fire smell, it still smells smoky in your house, that they need to keep them on if they're going to be reoccupying those houses?
I think it's not really practical for people to be wearing these for a long time, but certainly if you're going back into the house and it's impacted, you're doing cleaning, you're remediating, you're moving things around, you're stirring up some of this dust in the early days. If you're smelling something, I think you should have that protection on. If you're still smelling the off-gas, and this is where you want to make sure there's air movement happening. If you have a central system, I'd run it, but with good filters. But I don't think people are going to wear this for long term. It's mostly for when you're actually doing the kind of remediation work, and you can actually smell it or see the soot and ash, or you're smelling those, kind of smelling the off-gas smoke.
Yeah, I think that's practical and helpful. I'm just going to stay with you for a second, and also Dr. Love, feel free to chime in. These are very specific questions, but we have a lot of them. Can washing clothes or bedding remove all toxic particles, or should they be discarded? It gets back to the fabric issue. But again, people want to know, if I wash it, I also have a question about, if we're boiling, if things are going into boiling water, does boiling water remove contaminants? So I'm giving them all those kinds of questions over to you guys.
I'm happy to take a shot at it. I'll tell you how I would approach it if it was my house and impacted materials. I think you could do a good job of cleaning clothes. In the wash, you're going to drive off a lot of the particles. And even during the heating process, you're going to drive off a lot of these gases. They're volatile organic compounds. So in a heated dryer, a lot of that's going to be driven off and it'll be exhausted outside. I think this is also one of these things where you can give it the smell test, to be honest, afterwards. If it's not driven off, you can have a couple cycles of this. But I don't think, personally, unless it was really heavily impacted and unsalvageable, fully soiled, I personally would give it a shot at washing, and I'd feel comfortable with that.
Dr. Love, I'm just, are you feel similarly?
Yes, I think if you can fit it in your washing machine and have it go through a washing and drying cycle, you're probably in pretty good shape. It's really the fabrics that are harder to do that, right? You can't stick your couch in your washing machine. And so things like that become much more difficult to get 100% clean, just because you can't get as much water through it. You can't get as much heat through it. And so those are, more difficult ultimately.
Yeah, very helpful. Dr. Lowe, I'm going to go back to you. We have some very specific questions about particular testing. One is at the Altadena Golf Course. A person has noted that the county lease with EPA required that there be neighborhood air monitoring. They think this is different from what AQMD is doing, but they're wondering if have any information about that and where they could get the results from that air monitoring. I'm hoping we didn't lose Dr. Lowe. You would need to unmute.
Sorry, I was trying to distinguish between Dr. Lowe and Dr. Love.
Oh yeah, no, it's true.
Yeah, so the Army Corps of Engineers is doing some perimeter. They also do some personal air monitoring. They also have what they've mentioned is a community air monitoring site. So I think at this point I'm not aware of them releasing that data publicly. They are being able to share in some of the meetings in terms of some of the air monitoring results that they see on a periodic basis. So that way they can let us know if what they're seeing as they're working through the work sites. So right now, we're talking to them about that data, and stay tuned.
Yeah, they're very helpful. And again, we'll try to get answers to some of these questions and get them posted on our website. Another, I think this is a great question / comment. Is there any way for community members to report that they have concerns about their air quality, so that you can track even more information? I think there are some folks who actually have their own air quality monitoring tools, and they'd like to contribute to this knowledge base that's getting built up, and they're just wondering, how do they communicate with you, with South Coast AQMD, about what they're seeing, what they're finding, or get somebody to come test it. We've got a bunch of questions on this, so I'm combining them.
Right. So I think let me separate that into two categories. One, if there's an air quality concern, if there's like a smell or something that is concerning to a community member, we do have a hotline, 1-800-CUT-SMOG, for general inquiries, and that would go to our inspection series of inspectors who will respond very quickly to be able to assess what the need is. If there's something with regards to the specific wildfire, we do have our email address, wildfireliaison@aqmd.gov. That's WILDFIRELIAISON@aqmd.gov. So if there's any wildfire related questions or concerns, that would be the email address to email, and then we'll distribute it amongst the appropriate team members to do the follow-up.
That's really helpful. I think I just want to note that I'm really sympathetic with the comments in the chat about feeling let down by both insurance companies and government, in terms of particularly for those of you whose houses are standing and you seem to really not be getting a lot of support from your insurance companies, and there's really no government program helping you clean up. So, I want to note, we hear you on your frustration. I want to give an opportunity for any of our panelists and also for Dr. Quick and Dr. Davis to just, offer any advice we can, particularly on two issues that have come up a lot. One is trying to get insurance companies to pay for testing. And again, I want to know, Dr. Allen, Dr. Love, you've been doing this work for a very long time in other areas as well. So if you have any advice about what we could try to do, either collectively or individual people can try to do, to making sure that where testing really would be helpful, the insurance companies are covering it. And then I think there's, a sort of corollary, complementary question about paying for cleanup. and remediation in places that really have had a fairly significant exposure to smoke, soot, and ash. So I'm going to open that wide, and because I really respect that people are letting us know that this is a real gap for them in trying to feel safe about going back to homes and being back in their communities that they love. So anybody, Dr. Quick,
So,
oh yeah, who's jumping?
yeah,
Dr. Love.
yeah, I mean, I think what you're posing, right, is exactly one of the data gaps we're trying to help fill, right? I think one of the things that without data, right, it feels very speculative as to whether or not there are impacts or not. So one of the things that we're hoping to take a look at is, through our representative sampling, is what is reasonably expected, and the degree to which we're able to, fill that data gap that says, hey, if you're in this condition, it would be reasonably expected that your soil, is, significantly impacted, right? That at least fills that data gap that I think people can sort of look to try to justify whether or not their specific parcel warrants additional sampling.
Yeah, that's very helpful. I don't know, Dr. Quick or Dr. Davis, advice?
So I don't know that we can answer the question around getting them to do testing. I think the hope that we do have is that they do what's needed to remediate the smoke damage that was present. And whatever that full source of things is in terms of doing that. But the question around testing, I'm not sure of in terms of how they go about that. But I do know that they oftentimes have experts that can assess the situation in terms of your property and make recommendations or create a plan for specifically addressing the issues that are identified related to smoke damage.
Yeah, I think it is a reasonable request for people to get additional support. And thank you, Dr. Love. I mean, I think we are trying to fill a gap, and we are trying to be able to identify that there are reasons for people to be concerned. And then, as Dr. Davis mentioned, the concerns are obviously legitimate. There's information that shows that there are legitimate concerns. And then it really is the job of the insurance companies to go ahead and cover that remediation so that your homes are in fact safe for you to occupy. We're going to continue. Go ahead, Dr. Davis.
Yeah, I do want to add, I mean, the Department of Insurance has also put a hotline for people to be able to reach out to them if they can't get questions or concerns answered from the insurance company. And that number is available on our website. I'll just say it here. It's 800-927-4357, or you can go to insurance.ca.gov. Really, and they're there to try to help answer questions if you're not getting good answers from your insurance company.
Yeah, thanks so much. And then so just I'm going to go. I know we only have a few minutes. I'm going to try to get to some questions that we've had multiple times tonight. How does rainwater runoff affect the spread of fire-related toxins in the soil? So again, wide open, Dr. I don't know, Dr. Olivares, if you want to start with you, but a lot of people and some of the data that we saw, certainly on our air quality, we know when it rains, the air quality gets better. But I think this question is, when it rains, does the quality of our soils get further contaminated, or and this is even more than just, is there a runoff issue, but I think there's what happens when it rains to the soil.
Yes, absolutely. I can take an initial thought about that. So I think we can think about buckets, like where the pollutants are. So we have like pollutants like in our atmosphere bucket and the air, or if they're at higher elevations, then we get rain. And that, because we're in a slope from like going from the mountainside right all the way to the beach. So that is going to, as the rain is falling, some of that water is going to go to runoff. And actually, the majority of the water is going to go to runoff. And with the slopes just and the force of the rain, that's going to drag along all the accumulated ashes and sediment and particles that have deposited throughout the time in between the rain events. So this is actually a phenomenon that is well known for fires that is called the first flush effect. And essentially, like a lot of these materials are flushed. So instead of you're thinking, well, we add more water that could be diluted, actually no, what we see that these initial storms after the rain usually is when you see higher amount of carbon in the streams, higher amount of nutrients, metals flushing out, and in some cases also some increased number of bacteria. So much so that this connects, I think, beyond talking about fires, and back to the question that we had about recreating in beaches, that there are monitors, right, of coastal water quality to know whether the indicators of pathogenic, so disease-causing microorganisms, are high enough that it's recommended to avoid swimming in the beaches. So I think this is a phenomenon of like where the pollutants are moving around. They're not going to disappear automatically. So they're going from the bucket of the atmosphere or higher elevations to the bucket of the runoff, and eventually making it their way through the slope in our region.
And I don't know, Dr. Love, if you want to talk about in particular what happens to like the soil in your yard.
Yeah, I mean, soil in your yard, if you have areas where you have, a significant amount of water, it can move the soil around. So if you have impacts in one area, it has the potential to spread it. It has the potential to move, potentially go to a neighbor's yard, right? I mean, and so the degree to which some of these contaminants are stuck onto soil particles, stormwater absolutely has the potential to spread it to surrounding properties or other parts of your existing property.
Yeah, and maybe a follow-up question for that, and for you and for Dr. Allen perhaps is, are there ways to decontaminate the soil? So, we know that in the burn areas, as part of phase 2, 6 inches of soil is coming out. Should people be taking, if they're in adjacent areas or they're surrounded by fire debris, should they be taking out 6 inches, or should they be doing something else? Can you just take out 1 inch and add some topsoil? Can you put some charcoal? I mean, folks are asking very intelligent questions here. Can you put some charcoal in your soil? Like, what could you do to remove contaminants from your soil so you can decontaminate the soil?
Removing these contaminants is difficult. Most people, when they're dealing with metal contamination in the soil or pH contamination in the soil, the cleanup process is really about removing and replacing the soil. And so, the degree to which people have impacts that are significant to that degree, removal is the standard of practice.
That's helpful. Dr. Allen, I don't know if you also want to chime in. I know you have a lot of experience working with families.
Yeah, I agree. I mean, I think it depends on the extent of and this is where some of the soil testing, and soil testing isn't all that expensive. And again, you could test for a whole lot of things, but for me, I'd test for some of the metals, some of these indicators to see the level of impact. It's relatively pretty inexpensive, I think, for environmental testing, and there are plenty of places you can do this. The public can do it. But yeah, I agree. It's going to be either replace, so how far do you have to go down, or recover it. And I also think this is where some of these, again, the control strategies, like, we do this all the time, and where there's impacted soil unrelated to fires, where you just want to really manage how much of that dust is coming into the home. So again, simple things, kick the shoes off, and then again, controlling the dust through wet wipes, wet damp wiping surfaces, and these same HEPA vacuums, and also having the air cleaners going. Again, this really helps. Even if you're tracking something in and you're not quite sure if that gets stirred up, it's really going to help. So outside of full remediation, that's again what I think you could do. I would do some personally. I would do some of these low-cost tests myself. There are plenty of places. There's even some groups that are doing this for free. I could track down the link that are offered this as a service to the LA community. One of the universities is doing it. You can get a sense of the metals and get a sense of really how much you have to remediate, how deep you have to go, or you could just put a layer on top after a light remediation versus going 6 inches or more.
Is it possible to also, and people are saying, can I put a cover on this, I mean, this is LA. I know you're over there in Boston, but in LA, everyone's outside all year round. So outside spaces are part of everyone's home. So people are saying, can you lay something down, cover the contaminated soil, and then put like 2 inches of soil on top of that? Like, I mean, people are asking very specific questions, but I think it is because the outside is so important. And again, while in the areas where homes were burnt, or the properties where homes were burnt, they are taking off 6 inches of the soil. In the areas that are adjacent, where the homes have not burned, there is no public program for removing the soil.
So in terms of, we talked about treatment being removal, but there's also, as you described, mitigation approaches. And the main one is, like you described, just preventing exposure to that soil. And you can do that, by putting down a layer of fabric and putting soil on top. You could do it by building a patio on top, right? Things that just prevent the soil from getting resuspended, prevent you from digging in the soil. All of those things that reduce exposure are widely accepted approaches where if you have some things in the soil, instead of removing it, you just have to create these sort of controls that limit your exposure. And those are 100% acceptable alternatives to removal.
That sounds great. Dr. Allen, were you going to chime in?
It's related to this conversation of soil and impacts and migration, and everyone was talking about, but I do want to say the consortium, we actually working with a group at UC Irvine that we're doing some of these surface water flow maps to understand, as we have the burn scar area, where do we think, it's not just going to be random, where that transport's going to happen. So we're going to produce these. So hopefully in the next week or two, we'll have some of the early maps to show which areas adjacent to the burn scar areas are most likely to have the contaminant transport after a rain event. So I just want to close that loop on that.
Yeah, that's great. Dr. Quick, I to close us out, just because we do have some questions again about precautions. So I'm gonna try to move quickly, but folks are asking, are there guidelines for children and pets playing in yards with potential contamination? And I know we have guidelines, so.
Yeah, a couple comments specifically for pets. One thing to be aware of with pets, and you've heard this from Dr. Allen and others tonight, the idea of not tracking stuff in from the yard and going in. For pets, that may mean actually washing your pet's fur and paws off. So that's just one general one for pets. If you know right now that you have fire debris in your yard, there's no contamination right there, not letting children or pets on that is probably the best option right now before you decide what sort of route you're going to go for this remediation. And you just heard, I think, a great discussion on some of the things that can be considered in that. I'm just going to touch on sandboxes because we've had a lot of questions about that. Don't know if we have some tonight. In general, we have cautioned folks that if you have a sandbox that has a significant amount of ash and soot that was in it from the fire, that it's probably reasonable to replace the sand. If there is no visible ash or soot in there, then probably doesn't need to be replaced. But those are some of the things to think about. One more I want to add. For children that are at the age of a lot of, hand on the ground, on things into the mouth, make sure to wash down play equipment that you might have in your yard frequently to make sure that kids are not introducing that into their mouths. So play equipment, toys, and so forth.
Yeah, I mean, I think our principles are our guidance is built around the principles that you do not want to ingest, inhale, or come in contact with fire debris. And everything you can do to sort of minimize that is to your advantage, and even though, we are weeks out of the fire, the exposure risks remain because there still is a lot of fire debris in the area. And for some of you, you're living with that reality. I hope you know that, we're here to be helpful, to support you. We're going to continue to hold town halls so that we can answer your questions. We're going to continue to bring in the experts, as you see, from across the country to help answer the questions. And we're very grateful to all the partners who are here, working with us, conducting assessments, doing some ongoing monitoring. You heard tonight, and there were some questions about, is this all just one time? The consortium is looking to continue to be able to do monitoring over many years. And some of our state partners and our local partners will always continue to do monitoring as part of, their obligations to the public. We have created this one site where we're hoping you can go to get your updated information on what kind of assessments and monitoring is happening. And then as results come in, you'll be able to see results posted there as well. I want to thank everyone for joining us. I want to particularly thank our panelists, our speakers, the folks who helped answer questions. We appreciate your taking time to share with us. Mostly, we appreciate all of our residents who joined us tonight. And please don't hesitate to get in contact with us. As I said, you can go to our website. If we didn't get to your question tonight, we'll try to post some general responses to the questions on our frequently asked questions page over the next couple of days. But you can also email us with your particular question, and we'll try to get back to you as soon as possible. Thank you, everyone. We'll be back in the next week or so with additional updates, but we thank you for joining us tonight.